Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Welcome back to another episode of the Chaos Whispers of Healthcare. I'm your host, Dr. Megan Carter, and today's guest is going to give us so many incredible insights about leading in a broken healthcare system. Dr. Christopher Kodama is a board-certified pediatric hospitalist who brings over 25 years of experience as a CEO, executive, and physician leader with a track record of successfully vetting and launching new companies, building high-functioning leadership A teams, and leading the implementation of a wide range of complex strategic initiatives, programs, and turnarounds. Applying his passion for creating clarity out of chaos and connecting dots with systems thinking, Dr. Kodama advises leaders and facilitates group efforts to flip dilemmas into strategic opportunities, navigate the volatility of translating strategy into results, and engage people in ways that promote purpose-driven culture to fuel sustainable company success. He has presented at numerous national and local professional conferences and community events on matters related to effective problem solving, performance improvement, and leading diverse stakeholders through disruptive change. Welcome to the show, Christopher.
Thank you, Megan. It's a pleasure to be here.
Yeah, we're excited. That is one heck of a verbal resume, sir. And I know I haven't even mentioned half of the incredible work you've done. What is clear to me, though, is that you have a heart for bringing clarity in the setting of chaos. And what better industry is there for this skill set than the U.S. healthcare system, right? Knowing that you're currently an entrepreneur as the founder and principal consultant at your company, EverSpark, could you share with us how you pivoted from traditional healthcare leadership and became a healthcare innovator?
Sure. I think the common thread here you've mentioned before is what got me into medicine initially was a passion around advocating for others, particularly those without their own voice. And that's what led me to pediatrics. I think the common thread throughout my clinical and leadership career has been what you've mentioned around my interests in creating clarity out of chaos. So as a hospitalist, you're oftentimes in a very similar chaotic environment where you have a patient and their family who are at a very vulnerable moment in their time, moment in time, and there's so much going on, lab tests, imaging, and if they're sick enough to be in the hospital, it's a little bit more involved. So being able to pull all of that chaos or a lot of different points of view and perspectives into a cohesive plan that you can then implement with a goal in mind always really appealed to me in the clinical sense. What I didn't realize was there was an opportunity on the leadership and management side. It's analogous in many ways to what I was doing clinically as a hospitalist. And so that's how I found my way sort of opportunistically into the realm of healthcare administration, and found the canvas to be so broad and the opportunities to be so wide-reaching that I ultimately made the change from affecting change one patient and family at a time to more of a systems approach. So having spent as long as I did on the management side, primarily focused on acute care operations and all the craziness that happens, as we know, in healthcare on a daily basis. There's the best laid plans you have for the day or the week, and then there's the reality of the tyranny of the urgent, the emergency that comes up that distracts you from getting the stuff done that you had originally planned. So what can you adopt as best practices and things that you want to have the foresight to try and avoid or mitigate as you're building your company and your team? And so having had the opportunity to do that, I tend to be more of a generalist. So I like to learn a lot of different things. And ultimately, I think a lot of what you and I talk about, Megan, is building community. I think it's really easy to feel isolated, that you're struggling and overwhelmed when it's just you running from one fire to the next. But to know that there are others out there, some who have uh, figured out some hacks, perhaps is the right term, to help them navigate that, and being able to pick and choose and curate through your network what might work for you and your situation and your personal style. And in many ways, that's sort of um, a backdrop for what I want to be able to do through my consulting practice.
I love that. And I love that so many of our guests have unique paths going from sort of, what we'll call traditional healthcare leadership roles into entrepreneurship. And I heard you mention multiple pivots for yourself throughout this journey. And I think that's one of the biggest aha moments for me when I first left the traditional healthcare leadership world was your options are endless. There's so many you have so many skills and experiences as a clinician to bring into the business world. Okay, maybe we don't know marketing 101, but we know how to be authentic and how to share our story. We're really good at that in healthcare. So I love that you shared that. I can say with full honesty that you exude genuine compassion, empathy, and a desire to do good in the world. And despite the noise and all of the ups and downs of being a healthcare leader, you continue to find ways to support that sacred work of healing. It's hard for me to imagine that you ever feel frustrated or overwhelmed because you're so polished. But we also know that that's the most human experience we all share, no matter what work we do. So, out of your many years of that operational leadership experience, what was the most chaotic moment in that journey for you?
There, just one.
I know, there's 100 to choose from.
Well, I think there's so many different chaotic moments I can think of. I'm going to pick one that was further along in my leadership career, simply because there were things that I had learned from similar types of events earlier in my career where I felt so paralyzed and overwhelmed that I didn't even know where to start. I remember early on in my leadership career feeling very overwhelmed, and I had two supervisors. It was a matrix reporting relationship. And I went to one and I said, I'm feeling really stressed out and overwhelmed, something to that effect. I said, I'm just exhausted. Like, is this ever going to get better? And I asked that same question to both of the supervisors separately. The first one said, absolutely, it's going to get better. Just keep putting one foot in front of the other and you're going to get there. The other one said, no, it's not going to get better, but you are going to get better at managing through essentially the chaos, although those weren't the words, but you'll get better at managing feeling overwhelmed. You're going to figure that out over time. And he was a really wonderful mentor and soundboarder. And that's always really stuck with me. So that's what colors the example I'm going to share with you now, which was about 8 years ago. I was entering into the 5th year of a startup company. Things were going well. We were growing. We were getting infrastructure established. We were finding our way. And as part of that work, we collaborated with other health systems in the region. And so I was asked to take the lead from our organization to co-develop a business plan for a new company. Then there was an ask that was brought my way from my supervisor saying, listen, we have this department. The leader has left suddenly. We need interim coverage. And I'd like for you to take this on. And I'm like, sure, because I don't have anything else going on. Yes. So that was a full-time role that ended up being a lot more than I thought it was going to be. Part of the unsaid ask in stepping in an interim capacity for that area was to reintegrate those two divisions into a unified program and then hiring an inaugural leader to lead that, kind of rebasing their strategy and the vision for that department, and then bringing in a new leader to kind of breathe life into that over time. So,
Which sounds like two full-time jobs, by the way,
yeah.
as you're
Okay. So
describing
now
it.
we're
Yeah.
up to about 2.5 full-time jobs.
Yeah.
One of the tactics that I employed in that conversation was I would love to help out. Here's what else is on my plate. And here's some options. One option is rather than do 100% of what you're asking, I can give you 10 hours a week and let's hone in on what your key priorities are. Let's stick to 3 that I can realistically accomplish in a measurable period of time. Or we can go to my supervisor and have a conversation. So I was essentially reporting to 3 or 4 different senior leaders in the organization across all of these different activities. The other alternative is we can get together, circle the wagons, and figure out what's going to come off my plate or not, so that we can go through a prioritization exercise and figure out the best way to allocate my time. It almost was sort of like being in a sandstorm and the sand is constantly shifting under your feet. But so it was probably one of the more chaotic times in my career, but also I felt more equipped to manage through it and still maintain some degree of work-life balance and sanity in the process, as opposed to if those circumstances had occurred early on in my administrative career.
Yeah. It's so powerful. When you first shared this story with me, all I could think was yes and yes. Been there. And I wish I had known about those important lessons you just shared so much sooner, because so many leaders, especially in healthcare, we just say yes to additional assignments and work because we're all united in this altruistic desire to help. And so often these higher level leaders, they can unintentionally view that, whether they realize it or not, as an opportunity to keep piling on while they try to delegate their own workload. And I saw that to be even more prevalent with our physician leaders, because they are seen as the ultimate subject matter expert, which they are, but they're not robots. They're human too.
Well,
And hospitals often take the most experienced physicians and ask them to lead in a formal role without offering much onboarding or training too. So let's talk a little bit more about those practical strategies you would share with a healthcare leader or a new physician leader who might be feeling that same pressure of taking on additional work or roles. What are the first 2 or 3 strategies you would recommend for them?
sure. So there are 3 things I'll mention, and I think they apply, frankly, at any stage of one's careers. And the first would be prioritization. The second would be managing expectations. And the third would be discipline. If we start with prioritization, I think one of the most important things you have agency over as a leader is what's on your plate or what you've been asked to do. Starting with what are the key priorities. So in the example that I provided, one of the things I knew was my first and foremost job was running the company that I was already charged with doing. That was a foundational expectation. So you have made a commitment to do. And so understanding that helped provide some context on capacity for other things. So the business plan, what are my top 3 priorities? What levers do I have available to me? Is there a deadline? Does it have to be sooner rather than later? Or can I stage this so it's longer term? So the more I take on, a lot of times it's getting a lot of things done over a longer period of time versus a select few things in a shorter period of time.
Yeah.
And figuring that out across the different areas that I was charged with leading was really helpful. And with that came the second tactic. I grounded myself in what I thought to be true, and then I tested it. So I call this a calibration exercise. So I went to the people that were coming to me or asking me to do these different things and saying, here's what I see as the greatest priorities based on what you've been telling me you need. Did I get it right? And are these truly the priorities? So, for example, doing the interim leadership at that hospital, we identified, instead of just plopping as in the interim, I'm going to cover everything day in and day out, all the fires, all that stuff. We said, there's some foundational things that need to get done here. Are these still the right things? Because if we don't have some degree of strategic vision, it's going to be harder for us to understand. And then the third thing that we identified as a priority was there was a strategic partnership with another competing health system in the area that as luck would have it, I had been involved in the first turn of the wheel years ago. There was an opportunity to vitalize that relationship as well. And those were the three things. It was almost like a negotiation back and forth with the two executive sponsors to say, are these the three right things? What are the measures of success? How do you know that I'm actually contributing in those areas? And because I had that clock ticking in the background that I had until the end of the year before I left the organization. Like, what in these three areas can I accomplish between now and the end of the year? Yeah. And then effectively translated that into an internal statement of work. So we codified it, we documented it, said, here are the three priorities. I'm going to give you 10 hours a week. Here's what I realistically think can be accomplished between now and the end of the year. So the takeaway here really is, can easily devolve into a thank you, sir, ma'am, may I have another type of a dynamic where people keep chucking stuff over the fence. But the reality is you have agency as a responsible adult and a leader. And it's not that you're saying no or pushing back. There are ways to do this. There's the Robert Urey book, Power of the Positive No, that I'm a big fan of. I heard a rumor once that he had said these are the same authors that wrote the book Getting to Yes. Okay. And they said actually they wish they had flipped it and started the series with the Power of the Positive No first, because that's something that people tend to struggle with. Right. And I translated that in these different examples related to the chaotic event to say, I don't think I can do what you're asking, but I can do something. So let's figure out what that is. And then in another context, it was, I could do those things, but it means something else is going to slip off the plate. So we either need to reimagine the expectations, right, or we need to understand that there's some things that we need to deprioritize. Yeah. Because I want to do a good job for you, and I can't do that if I'm spread too thin or if I'm so overwhelmed and burnt out that I'm not thinking straight. So there's a lot of mutual benefit in having these types of conversations. It might seem a little scary, and I recognize that not every supervisor or senior leader, that their style will be compatible with this type of approach. I think that that's a reasonable place to start, of the prioritization and the curation of expectations. Once I figured that out, okay, now I know I've got these 4 areas I've got to cover. I've got specific priorities in each of them that I need to check off the list before the end of the year. Yeah. That's where the third principle of discipline comes in. And on a very concrete level, what this meant was communicating with key leaders in each of those areas to let them know and kind of negotiate what our dynamic was going to be. Was it going to be weekly touch bases? How was I going to keep in contact with them and update them on the progress? It's really kind of that discipline of being transparent with your other stakeholder leaders. But I took it to another level with a really wonderful administrative support person with me at the time. And every week at the beginning of the week, we would reground ourselves in the 4 areas I was responsible and what the priorities were, and then translate that quickly into, as meeting requests are coming in, here are the priorities for this week or the next 2 weeks. We've got to get X, Y, and Z done. Some of them were so obviously not related to the priorities that she could push those off or schedule them later at a time when it wasn't so intense. Or she could schedule those. And then for those that were kind of in the gray zone, she would contact me and say, not quite sure how this fits in with the priorities we discussed at the beginning of the week. What do you want to do? Yeah. And that gave us the opportunity to practice and calibrate. So then she got better and better each time the week went by. And then similarly, it also empowered her to hold me accountable. Yeah. So when I would say, can you get me a one-on-one with so-and-so? She's like, okay, so I'm not understanding how this fits with the priorities that you told me, and you've got limited time on your schedule. Yeah. Is this really what you want to be doing right now? You're right. Thank you for holding me accountable. So having accountability partners that you trust to be able to kind of keep you honest, even just writing down your key priorities and putting it on a Post-it on your computer. The way my brain works, actually create a matrix grid Monday through Friday. So it was sort of like breaking it down saying if
Yeah.
this is what I've got to get done by the end of the year, let me deconstruct that
Yeah.
into a work plan where I have some degree of confidence that if I do the things that I put on this matrix every day, it's
Yeah.
going to get me closer to that goal, which
Yeah.
those goals have been validated with the sponsors or the customers. So those are some assortment of little tactics that I've used, but really coming back to those three: prioritization, managing expectations, and
Yeah.
practicing discipline.
So I love all of that. I want to distill that and keep it kind of bullet point practical for folks because you did such a beautiful job of storytelling with that. Like the context is so important. And my message to the listeners would be, while Dr. Kodama is describing a workflow for having multiple leaders and multiple companies even to try to navigate, I think I believe the lessons are still the same for us, which is number one, be very crystal clear about what's on your plate. Your leader does not know all that's on your plate. They can't. There's too many of you guys and only one of them. So be crystal clear. I did this in my practice as a director by having this massive whiteboard in my office, and the columns were divided by either my department or a project. And I updated it every Friday, similar to what you wrote down and we're talking about with your admin. The first time my CNO walked in the door and saw what I was working on, it blew her mind. And so she actually, because she had a visual transparency with my workload, we renegotiated what to add or what to take away. We do the same thing with nurse managers in one of my workshops where we have them brain dump all the tasks that they do. And then we create a top 10. So we create a top 10 document. These are currently, as of right now, their top 10 priorities. So when we go to a big meeting with department heads and quality and risk and lab and EVS, all have things for us to do. We pull up that same top 10 and say, okay, I can't add without taking away. So if you want us to, for example, do all the equipment inventory, we're happy to do that. Which of these other biomed related activities would you like to pause so we can make that happen? So I think the practical tips here are be crystal clear about what your work is, how much time you're spending on it, share that with your leader. And the third is negotiate. So as you're moving forward, how you prioritize your time and your energy, negotiate that and be transparent about it with your leader, which is so powerful. One additional question I want to pivot to real quick, because this is on my bucket list to ask you, because I know this is something you're very, very skilled at and you offer such incredible insight on. And it's related to managing those relationships between physicians and the other operational healthcare leaders. It can be an intimidating dynamic for newer nurse leaders. And honestly, any non-physician leader who steps into that role where they might need to have, some difficult conversations with physicians. We all need to have trust and be able to debate what's best for the team. So what are some of your top strategies to guide those newer leaders to build those strong relationships with their physician colleagues?
Sure. There are so many different ways to approach this. What has seemed to work well for me, and I actually learned this from a nurse leader colleague I was paired with as a dyadic leadership. And that was, it all boils down to the word you use, which is relationships.
Yeah.
And for me personally, the way that translates is that's relationship building, even when you don't need something from somebody, but for the sake of seeing them and understanding what makes them tick, and why they're there in the first place. I mean, there's a lot of thought work that I put into this. I refer to this as a critical component of developing purpose-driven culture, where every individual within a department or organization is keyed into what their personal motivations are for being there. Why healthcare? Why this unit? Why this type of nursing or medical care? And then creating the transparency as a leader to the goals that help us achieve the vision and honor the mission of the organization so that people can create this line of sight and a personal connection where they feel that their fingerprints are on the success of the organization. So that's really kind of in a nutshell, this notion of relationship management. And it may be people that you don't know if you'll ever work with them in a way that you'll have the opportunity to help each other directly. But stopping and having that conversation, getting to know a little bit more about them. What do they do for fun? What's going on in their day, without necessarily trying to troubleshoot or answer the questions for them. But the point here is if you can get to know somebody on a personal level and they can get to know a little bit more about you, there's vulnerability in that.
Yeah.
And it starts to plant the seeds for trust so that
Yeah.
when you do get to those crucial conversation moments, there's
Yeah.
context.
Yeah.
You're viewing them as another human being that you can connect to on a personal level,
Yeah.
as opposed to the hardcore, intimidating, bad behaving, whatever.
Yeah.
I think it's helps to balance that compassion we bring as professional caregivers
Yeah.
into maintaining accountability and holding candid conversations
Yeah.
with people. So I think it all kind of boils down to relationships.
Yeah.
The second thing
Okay.
is practicing candor.
Yeah.
Um, and I think a lot of times, and this may be cultural, it may be on what region of the country you're in terms of how direct people are. Candor doesn't mean being rude. It means essentially speaking your truth.
Yeah.
And I think we get scared about upsetting somebody because it feels like you're hurting them or you're harming them, which is antithetical to our clinical training and background. In reality, you're helping them by being honest. And I'll give you one quick example here before we uh, move on. But the first time I had to do annual performance reviews
Mhm.
as a medical director, these were people that I was working with side by side, may have been more senior to me in their clinical experience. Um, and suddenly I'm being asked to hold them accountable and provide candid feedback in their annual evaluations. And there was one in particular I was really stressed out about. I was fully expecting him to get upset and yell at me when I told him there were certain things we needed to focus on and work on. And I agonized over preparing this annual eval to the point that here's an example of overusing my skills. I got super analytical, got really objective. The narrative in the review was far too long, but I was processing and trying to do anything I could to diminish some of the stress and anxiety for myself. The day came, we sat down. I kind of stumbled around it and then thought to myself, just pull yourself together and speak the truth. And that's what I did. And I looked at him holding my breath, and he
Yeah.
said, this actually turned out to not be a waste of my time.
Yeah.
And he said, this is the first time. He goes, I know all of those things are true, but nobody's ever called me out on them. And I was waiting for somebody to do it. And the fact that you cared enough to spend the time to construct something that we could tangibly get after so that I can get better is greatly appreciated. I mean, that stuck with me all of these years, 20 plus years later. People actually know. And they might be upset initially. It just means that they're listening and they hear what you have to say. But that candor is really important too. Um,
Yeah, I think the moral of the story too, and I thank you for showing it because I have found both of those tactics to be true in my practice as well, which is, you know, making that strong impression of who are you as a whole person. So one of my free tools that I just added to my website was the what makes me who I am. And it's just a Word document that has like 20 or 30 questions on there for people to use at work that talks about who they are beyond just the title or who they are at work. And in your example, the physician leader, what was the first car you'd ever drove? We were in a leadership meeting and one of the physicians said, I drove a 1972 AMC Gremlin. It was red and he had a picture of it. And the whole room just erupted. And like three other people also had driven a similar vehicle. They don't make those anymore.
Yep.
So they bonded. I mean, what a simple, simple thing. But I'm not just Dr. So and so. I'm not just an executive leader. I also have this background. If you can create conversations, just a few minutes, you don't have to share anything deeply personal, but little facts about who you are beyond just the place of the workplace. That's an inclusion best practice that you're describing. And then the candor of, hey, I respect you. I have some feedback for you. Here's what happened. What are your thoughts? And inviting them into that conversation, especially with physicians who are also, most of these physicians, you guys are in these operational roles and you're still practicing. So most of you guys are at least two full-time jobs, if not more. And so as the operational non-physician leader, it's how do I demonstrate respect for your time and
Right.
get you the information I know you need and also talk to you as a whole person, not just a title or a role. So those are such great strategies. Thank you for sharing that. I am just such a big fan of yours. Thank you from the bottom of my heart for taking the time today to chat with me. If our listeners would like to connect with you further, Christopher, where can they find you?
The easiest way is to either check out my website. It's Everspark with a Q. So EVERSPARQ.com. Or you can use the same domain, and it's info, I-N-F-O, like information. So info@everspark.com.
Perfect. Yeah. And we'll include that in the show notes, audience. So don't worry about that. And all of these practical strategies that Dr. Kodama mentioned today will be included in the show notes as well. So be sure to grab them there. Christopher, thank you so much for all that you do for us in healthcare and for making the time to talk to us today. I really appreciate you.
Thank you, Megan, for creating this space to talk about these really important things. I think that the number one theme throughout this entire time has been about personal connection. And so creating that connection and community where people can learn from one another is so valuable. So thank you for doing that. Thank you for
Thank you
including me.
so much. Thank you. Absolutely. And until next time, friends, we'll talk to you soon. Thank you so much. Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.